So today my topic is feature of the blood supply to the brain, syndromes of damage to the basins of the anterior, middle, and posterior cerebral arteries. So blood supply to the brain. The brain is supplied with the blood by four arteries, two internal carotid arteries that form the carotid basin. They originate in the thoracic cavity, the right one from the brachiocephalic trunk, the left one from the aortic arch. Two vertebral arteries that form the vertebral basilar basin. Vertebral arteries originate in the thoracic cavity and pass to the brain in the bony channel formed by the transverse process of the cervical vertebra. So we have a circle of valleys in the base of the skull. The main arteries forms a circle of valleys from which the arteries that supply to the brain tissue depart. The following arteries are involved in the formation of the circle of valleys: the anterior cerebral artery, anterior communicating artery, posterior communicating artery, posterior cerebral arteries. So as you are able to see, the red color arteries or vessels are the circle of Willis, and those are the arteries which branch from to supply the brain. So internal carotid artery, it supplies blood to the most of the hemispheres, the cortex of the frontal, parietal, and temporal regions, subcortical, white matter, subcortical nodes, and the inner capsule. So carotid artery lesions, occlusive medicine, carotid artery damage, thrombosis, stenosis, a common cause of transient and persistent circulatory disorder. By intracranial thrombosis, internal carotid artery accompanied by dissociation of arterial circle of the large brain with ascending thrombosis. Extensive foci of the infarction develop. All this accompanied by massive neurological symptoms and often leads to death. Anterior cerebral artery. Its superficial branch supplies blood to the medial surface of the frontal and parietal lobes. The paracentral lobule, the partially orbital surface of the frontal lobe, the outer surface of the first frontal gyrus, the upper part of the central and upper parietal gyri, and most of the corpus callosum, with the exception of its most posterior part. So lesions of the anterior cerebral artery, extensive infarct can occur when the trunk of the anterior cerebral artery is blocked after the anterior connective or connecting artery departs from it, as well as with combined vascular lesions that prevent the development of compensating collateral blood circulation through the anterior connective artery. They are characterized by spastic paralysis of the limb, violation of the grasping reflex, and symptoms of the oral automatism. So the middle cerebral artery, the largest of the brain arteries, provide blood to vast parts of it. The following branches of the cerebral artery are distinguished: the central branch and the cortical branch. The central branch, which extends from the initial part of the arterial trunk, feeds the significant part of the subcortical nodes and internal capsule. The second one, the cortical branches, its anterior temporal artery extending from the initial part of the trunk of the middle cerebral artery and feeding most of the temporal region. Ascending branches of extending from the comal trunk, orbitofrontal, precentral, central, anterior parietal artery, posterior parietal, posterior temporal, and angular artery. Lesions of the middle cerebral artery. Clinical syndromes with a total heart attack in the middle cerebral artery basin. It consists of contralateral hemiplegia, hemianesthesia, and hemenopsia. For left hemisphere infarct, at the same time it occurs aphasia, mixed type or total. If right hemisphere anosognosia, if the basin of the posterior cortical branch of the artery does not suffer, then there is no hemenopsia. Sensory disturbance are less profound and speech is usually disturbed by type of motor aphasia. Posterior cerebral artery. Its cortical branches use the cortex and underlying white matter, occipital parietal region, posterior and middle basal part of the temporal region. Central branches provide its cover a significant part of the visual tubercle, the posterior hypothalamic region, the thickening of the corpus callosum, the visual crown, and subcutaneous nucleus. Branches also extend from artery to the midbrain. Posterior cerebral artery disorders. Bilateral infarcts in the orbital cortex, they may be accompanied by tubular vision caused by bilateral hemianopsia with the macular vision intact. If the visual field and the visual acuity in the cerebral infarcts in the basins of the posterior cerebral arteries are not grossly disturbed, then certain disorders of the higher visual function may be detected. So with bilateral infarcts at the junction of the parietal and occipital region. Sometimes there is a syndrome of agnosia on the face, prosopagnosia, when the patient loses the ability to recognize the face of relatives, friends, while maintaining the ability to recognize surrounding objects. Basilar Artery. It is located in the basilar sulcus mosta. The main artery gives off branches to the bridge and the cerebellum. Continues by two posterior cerebral arteries. Basilar arteries are supply blood to the occipital lobes, medial part of the temporal lobe, medial part of the thalamus, posterior femur capsule, the anterior trunk, and cerebellum. Basilar artery disorders. In 70% of the patients, complete blockage thrombosis of the artery is preceded by multiple transient circulatory disorders in the vertebral system, attack of dizziness, dysarthria, transient paralysis, and paralysis of the limbs, cranial nerves, and other symptoms. Occultation of the basilar artery is accompanied by symptoms of damage to the both half of the brain stem and defeat of its branches, symptom of damage to only one half of its motor skills and sensitive disorders, and defeat cranial nerve nuclei. Thank you for your attention. That's it.